Yesterday, I spoke with the chief medical officer at Eisenhower Health to get the latest on the rise in coronavirus cases there. And tonight, we're hearing from the director of infectious disease at Desert Regional Medical Center, which is also the sister hospital to JFK Memorial. I spoke with Dr. Shubha Kirkar. Dr. Kirkar, it's great to see you again. Thanks for joining us.
Thank you for having me.
First off, how are things right now at JFK and Desert Regional?
So as all other hospitals in Riverside County, we are, seeing an uptick, and the census, the COVID census is definitely on the rise. It's not as steep as it was back in June and July, but it is definitely increasing. And in the last 1 week, I think we have seen about 25% increase in the hospital admissions for COVID.
25% increase. Wow.
Mm-hmm.
How close are the hospitals to hitting a strain and reaching capacity?
Our capacity, we are prepared as we were back in April and May. Immediately as the lockdown started, we had surge capacity to meet the needs of the community based on mild surge, moderate surge, and severe surge. So I know that that is still in place. So we would be pretty much ready for any need that is presented. We are hoping that the curve is not as steep as it was back in June and July. It will be dependent on what the community does during the holidays now and soon after, and even in the future. I mean, before Thanksgiving and then before Christmas.
How concerned are you, Dr. Kirkar, that there will be a spike after Thanksgiving? And what is the message you want people to hear who are still gathering?
We really have to remember three things. It needs to be smaller, it needs to be shorter in time, and it needs to be safer throughout. Wearing a mask is going to be the key. Distancing is going to be the key. Outdoors is going to be the key. And of course, if it involves travel, really need to think about postponing it. Many families, many people have told me they are going to have Thanksgiving in July or some such things. Everyone wants to be connected, but we really need to take precautions.
Do you anticipate a spike in coronavirus cases?
I think that it is not even just anticipation. We are seeing a spike. We are on a trend going upwards. We will hope that the spike is not as tall or as steep as before, but a lot depends on being prepared and taking the right steps and talking about how you're going to do it safely.
What types of patients are you seeing right now with coronavirus? Are they younger?
I think we are seeing slightly younger groups, such as in the 30s, 40s, and 50s, rather than 60s, 70s, and 80s like we did in the beginning.
Let's talk about the vaccine. How do you think that will be distributed, and is it going to be, obviously people prioritize certain groups before others? What do you anticipate here?
So the vaccines are going to be deployed sometime as soon as, from what I understand, through the states and through the public health systems. Each hospital will have to sign up, which all hospitals are doing right now. I think there is going to be a top tier in terms of who are priorities in terms of getting people vaccinated, starting with healthcare workers, followed by risk groups that are highest and then basically everyone.
Dr. Kirkar, we appreciate your time. Thanks so much for joining us.
You're welcome. Thank you very much for having me.